We are live, you can begin.
Very good afternoon, everyone, and I would like to welcome all of you for yet another very important session on GAPSULEs. As you know, GAPSULE is a first of an industry dialogue series which is initiated by DocMo. GAPSULE aimed at bridging the knowledge gap between the healthcare industry and medical practitioners for better treatment outcomes. Today, our topic is revolving around the patient centricity. Patient centricity is something which is a very integral part of pharma industry, because what patient centricity is meant about is what patients need, and it's demanding part of it. Currently we see post covid there are a lot of advancement improvements have been done through digitization exploration, and where patients have been on the front face. There are changes in terms of management, in terms of thinking process, innovations, which is quite helpful in terms of making sure the patient becomes the center of discussion, center of all kind of initiatives to make sure patient comes first. But there are still improvement areas and some of the important expertise what we have initiated in the pharma have been enrolled. And to discuss all about these things, we have a very eminent panelist today for the discussion. And to start with, our first panelist is Mr. Naresh Katara. I would like to welcome Mr. Naresh Katara for this very important discussion. Mr. Naresh Katara is currently a founder and director at Growth Story, and he's a lead consultant at Zexel Medical Communication. Mr. Naresh has been devising strategies and building iconic brands like Augmentin, Siftum, Seretide, Rabipur, Cerevex across MNCs, GlaxoSmithKline Pharmaceutical, and Ranbaxy, and successful track record of over 26 years of experience in leadership role across India, UK, and Bangladesh. And also, he's been a founder of Growth Story and led the go-to-market strategy for new product launch like Colgate, Palmolive, and has been helpful building equity from pharma brands. I think it's one of the very interesting brief about Mr. Naresh Katara, because he has been part of pharma industry since almost 2 decades, and from where actually the almost pharma industry start evolving themselves in different aspects. Once again, I would like to welcome Mr. Naresh Katara for today's discussion. Our another
Thank you
panelist,
very much. My pleasure.
pleasure, sir. Our another panelist is none other than from the medical fraternity, Dr. Bharati Dhore Patil. Very good evening, ma'am, and thank you so much for joining for today's discussion. Dr. Bharati Dhore Patil, sir, ma'am, is a national vice president for IFS. Uh, she was a president in Foxy for 2016 and also POGS 2018-19. She's been past president for IMA Pune. Dr. Bharati was also a Foxy Star Award at 2016, Inspiring Gynecologist of India 2018. She is ex-chairperson for Clinical Research Committee, Foxy National Corresponding Editor, Fellowship Guide for Postgraduate Reproductive, Fellowship IFS, ICOG, Pune Women Icon 2014 Medicine. I think very sound and very pragmatic uh, introduction for Dr. Bharati, because she knows the fulcrum of every single magnitude and the factor which is required to make sure the patient is something very important. Once again, welcome Dr. Bharati, ma'am, for this important discussion, ma'am. Thank you so much. And our another panelist comes from an industry which is currently working on digitization post prospect. Welcome, Dr. Sandeep Sharma, sir, to our discussion today. Dr. Sandeep Sharma, sir, is a chief medical officer at Watch Your Health. He has more than 20 years of an experience working in healthcare, insurance, medical assistant industry, and senior management positions, handling both domestic and international markets. He has worked across various functions with companies like ICICI Lombard, ICICI Prudential, Paramount Healthcare, and Assist America Medical Emergency Service. Dr. Sandeep has spearheaded projects for starting joint ventures with TPAs in Sri Lanka, Bahrain, as well as inbound healthcare facilitations. Once again, I would like to welcome Dr. Sandeep for this very important discussions, because the expertise what Dr. Sandeep brings in is something which is related to the supportive function for the patient's point of view for making sure They are at absolutely comfort zone when it comes to taking right treatment for longer perspective. So once again, thank you so much, our respective panelists today for such important discussion. Now, today's this objective, what I mentioned, is about patient centricity. So the first and a very important point we would like to discuss today is that how do you perceive its benefit and impact on healthcare? I think we should start with Dr. Bharati first because she is one of the front face in terms of dealing into currently patients also. What is your perspective, ma'am? Ma'am, you're on mute. Please unmute, ma'am. Yes.
Yeah, thank you very much and good afternoon, all. Thank you for the opportunity. This is something very innovative, very different topic, and it is very close to my heart because we all healthcare professionals are here only because of the patients. So, patient has to be in the center. So, once you have the patient in the center, definitely there will be a lot of benefits because it will be a direct communication with the patient. Need of the patient can be seen, and this is how we can coordinate with the patient. So if we can give a comfort to the patient, which is our main aim, I think things are going to be much different, and it will be at comfort, and there will be a lot of communication gap between the patient and the healthcare providers as such, like a medical professional or anybody, will be very narrowed, because health is very important for everybody. We are all living only because of our health. If there is a good health, everything is going to be good. Even if you are a little bit having fever also, trust me, you can't do or you cannot perform the way you have been performing for anything. So health is very important, and that's how it has been a concern, and that's the way we have to look at the patient differently. One more point, I feel it's a different when it comes to the patient. Patient doesn't come as a normal person. Like, you go to buy any commodity, the person will go very differently to buy that commodity. His expectations, his mind, his mental status will be completely different. But when the patient comes to a doctor as such, its mind setup is totally different. So even if buying the medicines or getting diagnosed, or all those things are totally different. So definitely it has an advantage of having a patient centricity. So once we start focusing ourselves, their situation, their perception, their expectations, all this is going to make a lot of clarity in overall dealing with the patients. So this is what I feel the benefits you overall, like, we go into the details, but this
Excellent
is
point,
overall
ma'am.
benefit. Yeah. The
Excellent
disadvantage
point, ma'am.
probably we don't know, because this is just a beginning. So
Hmm.
we really don't know how this is going to really work in a practical basis and day to day, because India is a vast and very diverse country totally. So how this is going to be happening, especially I know about medical profession. I can't tell anything about pharma, but definitely for the medical profession, we have three sectors dealing in India. One is a government setup. The second, we have a private, like local doctor, one-to-one doctor setups are there. And thirdly, we have a corporate setups now. So in these three scenario, the patients coming are different patients. So how this is going to make uh, we to go as a centricity towards the patient will be a challenge. But slowly, if we evolve very properly, things are going to work. And with this all advanced technologies and everything, this is mind blowing, sometimes bewildering, and we are still not figuring out ki how can we have the best out of all those things. So this is overall I see the benefits and disadvantages towards patient centricity.
Yeah, absolutely, very aptly said, ma'am. And I really like that point you mentioned about patient when buying a commodity and when coming for the health perspective. It's a different behavior, but yes, still based on the severity point of the disease, how they take their health as a first priority is still underdeveloped point of it. And I think it's a very interesting point what you mentioned. Mr. Naresh, being you a part of industry from last 26 years, and you have handled some of the biggest antibiotics actions, which is is currently the major fulcrum. From your angle, that this patient roadmap, which is one of the most challenging factor, how do you perceive from your angle the benefits and the impact of it in terms of patient centricity?
Yeah. Thank you, Udit, first of all, for having me on the panel. Uh, my experience, is across the asthma, antibiotics, dermatology segments. Uh, and as Dr. Bharti said, she looked at it from the perspective of a practicing doctor. Uh, there are different perspectives because there's no formal, definition of this word patient centricity. So what I would like to, look at is that how we means pharma companies and the doctors can engage and empower the patients with a single purpose, of having better treatment outcomes. Now, that is the ultimate goal of being patient centric. The
Hmm.
first thing, a lot of good pharma companies are beginning, to engage with patients even before the drug discovery has started or during the commercialization phase, so that they understand what could be the challenges during the commercialization and how things can be streamlined. So really great place to start would be even before the drug discovery and the commercialization of the brand. Now if you look at the drug or the disease management cycle, I think from a patient perspective, it all starts with creating the right awareness. If you have these symptoms, then you should think about thyroid, or if you have these symptoms, you can try and check out for prostate cancer. A lot of companies have started doing awareness because that is a lot of money spent on actually creating awareness, and the patient actually goes to the doctor. So that's the first thing that starts. Then the second thing about patient centricity, according to me, is helping in facilitating diagnosis. Of course, the doctors are masters in this, but there's a lot of continuous medical education available globally for doctors, in terms of better diagnosis. Point of care diagnostics are being launched by companies like Cipla, Lupin now, which will fasten, it'll hasten the process of initiating treatment. After that comes actually the treatment. Here, I think the biggest opportunity for everyone, in particularly chronic therapy areas, is the need to see how the patient compliance or adherence can be improved. Because if you see a whole lot of diseases, hypertension, diabetes, asthma, COPD, despite the best medicines being available, I think the treatment outcomes are far from what the patient can achieve. So a lot has to be done, in terms of patient adherence. When we talk about technology, we will see how DTX can help, how patient engagement materials can help, etc. And now the situation, as Dr. Bharti was also saying, is much different, in the rural markets. Whereas here, our challenges are of, adherence in the metros and urban markets. In the rural markets, we still have to work a lot on access and facilitating diagnosis. So if we all do this together, because it's obviously not a one-man show, it's not only a pharma or the medical doctors who can do this. I think there's a whole big collaboration required, to really deliver a patient-centric healthcare model.
Absolutely. The major fulcrum, what you mentioned about the patient adherence, specifically in chronic related ailments. But what is very important is how pharma and obviously from the healthcare professional side, both can put together work on that on a very consistent basis. Because some
Yeah,
of the places where the severity is quite higher and HCP required some kind of assistance from the pharma industry, they are absolutely doing it. But there has to be very consistent all across the liver and platform to make sure that every single patient has been properly take care of. That's very important. Dr. Sandeep,
yeah,
I think being a part of such important prospect of digitization and watch your health, your purview in terms of how do you see these two important perspectives, the benefits of it, and what are the key things which you have seen has changed a lot, that there is a there is a right shift or a negative shift which might give the perspective that still we are in the same position or like we are improving ahead.
Yeah, first of all, Udit, thanks to DocMod and to you for inviting me on this panel. And it's great to be a part of this prestigious panel. Dr. Bharti and Mr. Naresh has covered most of the points which I also wanted
Yes.
to say, but I have three quick points which I would want to cover, and I would want to put more on the benefits of the the patient centricity. Now, patient centricity is a subset of customer centricity. I would put it in simple terms. Whether it's the insurance industry, the pharma industry, or the medical professionals. Since I have been on both sides of the table, I have been into active practice during my earlier days, and now with the corporate world. I think the benefits are really increasing with this customer and the patient centricity in terms of when the patients are engaged in the decision making process. There would certainly be a decrease in the overall healthcare expenses because we are involving all the stakeholders, whether it's the patients, the providers, the doctors, and so on and so forth. More importantly, the enhanced knowledge of the health ailments which the patient is having and the health choices which he has, that would further enhance the care of the patient and decrease the level of illness because he is well aware of his ailments and he's involved in the decision making. That would eventually further reduce the readmissions, and it would be a better care after the discharge. And last and most important point, which the patients as well as the providers, the doctors would want, is a better quality of life for the patient. And if with the help of patient centricity we can achieve that, then both the doctor and the patients are satisfied. So I see it holistically that it's a positive move. Yes, we are still not there, but we are inching towards getting to patient centricity by the combined efforts of all the stakeholders, whether it's the healthcare organizations, the doctors, as well as the pharma industry.
Yes, I think yes, ma'am, you were mentioning.
Yeah. So overall, we see that there are four core concepts we have to evolve uh, around the patient centricity. Is basically we have to have the dignity and respect to the patient. That's very important. First, the information sharing, as Mr. Naresh was saying, information sharing is very important. Like layperson should know if I have a diabetes, what category diabetes I have, and how long, and how can I get better, or what happens to my body inside if I have a diabetes, kind of that. There has to be a participation, like pharma companies now coming up, like they are making that CSR activity, awareness, or all those things. I will make a lot of difference. It is not only the doctor's responsibility, but overall, if the pharma people or the healthcare professional starts taking and the collaboratively, we all together, if we can do these four core concepts, will build up this patient centricity better way in the future. This is what I felt.
Very good point, Dr. Bharti. As Dr. Sandeep mentioned, very interesting one. How we ensure patient engagement from the HCP angle, so that farm industry works on that. So when you practice in your day-to-day area, what are the key things you find as a challenge? Means suppose a patient comes to you and they have certain ailment, you provide them a proper prescription, counsel them about that disease, give them some information. As a pharma industry, what are the key aspects you believe that will really help that patients to make sure that the patient will take the medicine for a long time, apart from the medicines, other ecosystem areas where the dietary part of it, everything is can be properly take care, because we see 10 to 15% HCPs in India, which are majorly covering the metropolitan part. They still have the accessibility of such informations, and the patients are quite educative, informative, in identifying all such important aspects. But when we go downside, where specifically tier 3 cities, tier 2 cities, we see the first and obviously the target is patient has to be treated so that the patient is absolutely fine. But post that what? Patient doesn't come to a doctor, and then maybe there if the patient is having a chronic related issues like diabetes or CVD issues or any other ailment, then the patient start going to different doctors. That doctor doesn't treat it me very well, so overall the story started going in a different direction. So what are the key aspects of patient engagement, what you believe from the HCP perspective should be entailed to make sure the patient centricity becomes more powerful?
Did you ask me the question?
Yes, ma'am, this is for you, ma'am.
Did
Yes.
so,
Yes, ma'am.
so basically, I think the doctor-patient relationship is the key area. What has happened over a period of time through the competition, many number of patients, I think we are losing that touch, that contact. And this is what now you must have observed now in the universities that I think in US, Georgia University or somewhere, they have included spirituality angle into their curriculum of the education. What happens, what exactly we get it out of it is that the caring of the patient is and looking at the patient as a whole is being very important aspect, especially to get this connection developed. If you start getting that connection, if you start see, once anywhere you see the faith develops, everything else falls into place. So that I think that connectivity and the first patient uh, and doctor's relationship first is the key factor for all this patient centricity, and that core value of compassion has to be right from the beginning, inculcated into the young graduates. See, now the perception is that, you know, patient is a commodity, customer, and I have to give the customer what is customer is coming. But this customer is not coming as for any what you can say commercial things, but he comes with the health problem. Like he or she is presented herself or himself to you to get cured. So this is concept wise. If you start looking at it, I think people have been now in the index journal also it has been coming how your medical profession and the spirituality should align with each other, and that's how that gap is going to be lesser and lesser. See, unless you feel compassion, you cannot connect with the patient like that. I can understand this is not so easy also to do, but I think from young graduates, if you start inculcating them, how do you feel that? And that automatically is going to be patient centricity. This is once you start feeling about it, things are going to change. If I have a time, I'll just tell this is my now 35 years of the experience in the field of medicine. So I have seen this is a 3 decades of the patients I've seen. So I remember that when we started with our practice, or we used to go to our seniors and how they used to have a dialogue with the patient, and how the patient used to be listening to them. So that was instruction based dialogue between patient and the doctor, like instructions. The doctor is saying like this, कुछ नहीं सोचने का है, यही करना है तुमको, this is the way you should do it, nothing else you should do, bas finished, matter ends. That was a point blank, everything over there, and the patient used to follow that because there was no Google, there was nothing, no information, nothing at all. That time the doctor was everything. So point of focus was that instruction based, take the treatment. The second era came, like that era went, and then next 10 years came, and we realized that this era is a discussion based, like people started little bit information, little bit knowledge, education was little better, and the patients started coming, why doctor, and why not to do this, if we do that, if we do, and then finally doctor says no, this is the way you should do, this is a better way. Discussion coming out with a conclusion was a little better era that time. Then the next 10 years we have seen now is a debate. It's a debate. Why? How come? Why are you doing this medicine only? No. If you are writing these medicines, I should go and check that medicines. Doctor, why there is no alternative over there? So debate has make a confusion, a bias, and every chaos, because the person also doesn't know he is coming only on the information from the Google, doesn't have the knowledge perfectly. And if somebody is giving the knowledge, he thinks, he or she is thinking, no, 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 it is my right, because this is a egalitarian concept, like everybody is important. This is what is been actually was been happening. And this is how I think we have seen last 10 years before. Now we are seeing that it is denial. It's total denial. First is denial. You have a blood sugar level 120, 150 or 180. Why? Now, how? Why? Why is denial only? The first thing is a denial. I think there, as Mr. Naresh and Dr. Sandeep said, that we need to have awareness, understanding for them. Diabetes can happen to anybody, anyone, all human beings we are. After all, we are a living creatures of the God. We don't understand that. And we think that we are completely independent. So it can happen. And now, last era, just I have seen last 4 5 years, now things have been changing again. People have realized denial is of no use, debate is of no use. We need to be together. And then slowly, things are being changing. Doctors are also realizing that what I said is exactly the patient should not be copy paste, but patient needs to be discussed. Patient has intelligence. They are coming with their own health perspective. So doctor has to explain that. If a patient says, I don't want to take this treatment, you should agree to that and then explain them. If you don't take this, all things happens. Finally, decision is yours. And if this is the way we go to the patient centric, I think doctor patient relationship will develop, we build up, and this is how it has to inculcate, especially in the younger generation, so that they will not get frustrated when the patient asks few questions. So this is what is my whole perspective about your question.
Absolutely. Yeah, Dr. Sandeep was meant. Yes.
Yeah. I was very much impressed with what Dr. Bharti said, and I've just 2 or 3 points which I have to, second to what she's saying. Um, we all call it Google Baba. We get in our doctor group, we get these messages. Patients, मेरे पास में आया था, and he was saying, "Oh, मैंने ये पढ़ के आया. This treatment is not the right one. This is the right one which you are giving." So now doctors are becoming slowly but surely, on the lighter note, are becoming more of interpreters rather than caregivers. And but just to make it more factual, we have to also understand the patient's perspective. If they have any questions, we need to address those and make them understand, okay, you have read this article, half knowledge of anything is dangerous, and we are here to take care of you, we are here to support you, we are here to make you understand, and appropriate treatment can be given. Lastly, one more quick point. We have heard about 3 letters in medicine: ECG, EEG, and I have one more term which is E, E, and C, which is empathy, compassion, and emotions. So this is how you can get more patient centric. That's it. Thank you.
Wonderfully narrated by Dr. Sandeep, Dr. Bharti, ma'am. What you crafted is something in a nutshell. This is the fulcrum of the overall problem statement. And I think now I would like to have expertise from Mr. Naresh. How you feel that how much gap have been filled up till now, understanding the point of that in some of the very high prevalent diseases like diabetic, CVS, CVD, breast cancers, we see a huge amount of awareness that even
Yeah.
every single
Yeah.
patient knows about exactly what this particular disease is meant if they got
Yeah.
diagnosed into it. But
Yeah. Yeah.
there
Yeah.
are huge universe of different diseases where still the awareness is not enough in terms of giving them right perspective. What Dr. Bharti also mentioned is the counseling factor, and then narrated by Dr. Sandeep about EEC. As in pharma industry perspective, how do you see that? Which are the key steps to make sure that patient centricity can be on the front side rather than just the parallel side it's going on with the commercial perspectives.
Yeah. I think firstly, there's some very great points by Dr. Bharati about the doctor's compassion and really need to spend quality time with the patient. I think on the disease awareness front, I think a lot has been done by companies like Cipla, Dr. Reddy's, Sanofi Aventis for osteoporosis, asthma, Cipla, and hypertension. If you look at maybe Dr. Reddy's also, Cipla also. So awareness has been heightened about these diseases. I think one gap is that, of course, this has been more focused on the areas where we have our reach, and not the entire nation, because obviously where we don't have reach, we won't be able to get the business. But it is really required to go to those markets also and see how we can create awareness in the tier 4 and rural markets. The second gap which I mentioned earlier, I'm repeatedly saying this because I have experienced in the area of asthma that despite the best medications being available, adherence is not there, and the treatment outcomes are not good. Now, this is a gap which can be filled by both the pharma companies and the doctors, because in the doctor's chamber, the time is a constraint. In India, we don't have the luxury of 20-minute, 30-minute consultations. A few doctors might be giving, but on an average, it will be 5 to 7 minutes, as against 30 minutes, 25 minutes in the UK. So we need to supplement this time, by using paramedical staff, or by giving some very good materials, using social media to create awareness, using social media or digital therapeutics, to ensure compliance, so that at the end, we all get a very good disease outcome. The treatment outcome is good. So whilst I say yes, I think we are in the right direction, but as a country, we are so big, and our population is so big, and the percentage undiagnosed patients across therapy areas are so big, that still a lot of work has to be done.
Actually, I think all three of you have mentioned categorically the patient side of the challenges, how an HCP has to make sure that these challenges is very much taken properly in terms of not only the counseling factor but also educating them, giving them an empathy point of view, new style of counseling factor, so that patient first understand that yes, whatever HCP says is the right perspective, rather than coming with the half knowledge, which is going to be a evil for them. That's very important point which has been highlighted. Now, if I see how a technology has turned around this story, we would like to know, understand the experience part and what are the key things have been done into it. That will really help to understand how digitization or some other technological innovations has actually giving some kind of new paradigm into it, because in last couple of years we have seen how different innovations in technology have helped to identify the overall prevalence and giving the right preventive care in villages of India also, and a lot of diseases like TB, tuberculosis has been a paramount importance in India, and which has been taken from now the government perspective also, and technologically right diagnosis kit, identifying them, giving the right medicine at right time have been on a very big, large scale manner.
Yeah.
So, as a technology innovation, what are the key aspects we should see that these are the important parameters in taken? Dr. Sandeep, I think you have been a part of now this journey. What are the key changes you have seen into it?
From the technology angle, I think there are three major things which has happened in the last decade or so. One of them, which I would want to point out, is the virtual care. And even during the COVID times, we have seen how this virtual care, or so-called telemedicine, teleconsultation, has been of great help, because the entire globe was helpless. In-person consultations were not possible. So telemedicine, which was probably somewhere on the hindsight pre-COVID, took a front seat, and it had helped millions and millions of people. So I think virtual care is slowly but surely gaining importance, and it's continually growing. And it has to be aimed, to deliver timely medical attention, via regular check-ins during the treatments, the prescription adjustments, and so on and so forth. The second thing which I want to say is the remote health monitoring. Now, remote health monitoring has been a great asset, because it allows to collect the data of the patient remotely, and then track it with the help of some wearable medical devices. Now, this is very good, especially where monitoring of the vital parameters are required, especially after a surgery, to observe medical conditions on outpatient care. And last but not the least, the mobile health services, which is called M-Health services. Now, these M-Health, promotes the participation of both the healthcare consumers as well as the providers. And it helps in health education, as you rightly mentioned, reaching to the last mile through the mobile, because now if I'm not wrong, every second or third Indian would have a smartphone. So through these M-Health, technology, we can really reach out to the last mile for healthcare education, remote consultations, to some extent, at government level for disease surveillance, and even to align, treatments and drug references and so on and so forth. And one more point which I would want to make is there are a lot of controversies around artificial intelligence, which we really have seen nowadays. But if the right use of AI is done along with the health records which we have, a detailed diagnosis can be done, and medical decisions can be more precise and specific for each patient. So these are the quick points which I wanted to make on the technology aspect.
So,
Very, very well said. Yeah, Dr. Bharti, you please tell.
uh, he's been absolutely right and very to the point, Dr. Sandeep. Digitalization, data storing is going to go a long way. But somehow in India, we are not used to that. If we have understanding that if we can store all details of the patient, because if it is digitalization, how we are going to come closer to the patient. Like for example, I'm giving, if if we want to have a cervical cancer vaccination going all across India to prevent cervical cancer morbidity and mortality. Now, we do not have the access, we don't know how much data we have, that these are the patients which are more than 35 years of age, and they have come to a doctor or any white discharge or a certain complaint. How many patients should we approach back and give an awareness that that patient should come forward and get her test done, maybe pap smear or HPV test, or vaccination if it is in between 9 years to 14 years. So for that we need a data, we need to have that communication. For that patient centricity, if we want, we need that patient's information with us. So that is, I think, very valid point we have to inculcate in our day-to-day culture here. We are still, I think, 20-30% people are doing all data properly done and interpreting that data, but very few have been doing that. So if we can do that, I think digitalization will, technology will definitely make a lot of difference. Now, secondly, technology actually in the medicine has done a different part also. Like one way it is very good because we all know that, but slowly it has been taking us away from caring the patient, and it is been curing the patient more. So I think that's also one part has to be balanced, both the things. Now, new technologies when they come, probably to compensate what the interest coming on for that investment, or that investment to be sustainable, we go all out and out for advertisement. Sometimes patients have loss of faith in that particular technology. I'll give you an example. Lung transplant. Now, for interstitial lung disease, it's a very deadly condition where you can breathe, you don't have oxygenation in the body. So, you know that obviously everything. But now, interstitial lung disease, you can have a lung transplant technologically possible right now. But how many people would be aware of that? And in case of, suppose a organization in a hospital making an advertisement about it, many times it is taken that they want a money making, and that's why they have been seeing.
Correct.
So a lot of patients without any understanding, but it is possible. So whenever a doctor says to the patient, it is really possible, patient can have a best outcome provided there are conditions. It is not that everybody will have a best outcome, but this is the way digitalization, patient centric approach, because we all are working for patients, but it is only the communication gap. We are not able to communicate and believe faith on each other. If we start believing each other, I think things will work. This is what I usually feel. And probably one more point I always tell all my resident doctors and whosoever I'm teaching them. I said, see, there are gross body. We are gross body, which we have been with the panch mahatattva, air, water, ether, and these all panch mahatattva. This is a body. We are all looking at only this body. So this is a gross body, but we have a subtle body also. And that subtle body
Mm.
has mind, intelligence, and ego. So whenever you are seeing the patient, don't look at the body only, but we must try and integrate all your treatment options or whatever you have been seeing with the patient, looking at the patient's mind, intelligence, and ego. Integrate both the things, subtle body and gross body. That is going to be complete whole care for that patient. And that's how it will be truly patient centric, all aspects. So this is what I felt about when Mr. Dr. Sandeep said the digitalization. So digitalization is good, but I think we should not be forgetting that we are going to treat a human being. It is not again one robo to another robo. It is not one robo to another robo, but it is a human being. The connection is mind, intelligence, and ego. If you
Yeah.
understand these three things with the patient, everything is going to be fine. So,
It's absolutely Hawkeye. Means digitization is important. It's as equal as in terms of advancement, but you cannot control the patient's or human behavior. For that, you have to have a one-on-one physical connect in terms of understanding their emotional side of the story. Because if you don't know, then you don't know. Patient will go into denial stage. Then no technology will work for that. Absolutely correct, ma'am. But understanding these perspective now, if I say that if we want to improve in terms of which are the key areas, if I want to jot down from the priority point of view, which are the key important area which you feel in the patient centric care we should overcome as much as early possible to make sure that patient centricity start getting into the first priority key aspects, if I want to jot down, because we had a lot of conversation from the different angles. So, Mr. Naresh,
Yeah,
you want to emphasize on to it?
yeah, yeah. I think if you look at the big picture, I think a treatment outcome also depends a lot on holistic care. Earlier, the focus of pharma companies was just limited to the pill, to the prescription of the product. But in chronic diseases like diabetes, post heart attack, or asthma, in addition to the prescription, there is so much value in terms of other aspects like nutrition, exercise, lifestyle disease changes. So if all this has to happen, this I think cannot happen only in the doctor consultation in those few minutes without intervention of the pharma companies through a lot of materials or through complementary support systems which companies are coming up with now. So when you go to websites of Lupin, Cipla, Dr. Reddy's, you see a lot of new campaigns like Swas and Breathe Easy, where they are reaching out to support the doctor in terms of the patient adherence journey. So I see some questions, on why patients are not adhering. So patients may not be not adhering only because of the cost of treatment. I think the biggest challenge is, when the symptoms go, patient feels that the disease has gone. Whereas in asthma or hypertension, it is certainly not the case. unless your lung function has come back to 100%, you still are unable to do what a normal person can do. So that understanding itself, is missing in the patient's mind. So raising the expectations, of the patient from the treatment is one opportunity or a gap. Only when that happens, only then the patient will be able to take the treatment.
Am I audible?
Plus the other aspect, which I would touch upon very briefly is the slow but a good emergence of digital therapeutics. A stream which is coming up, where they are completely supporting remote monitoring of high risk patients, and using digital artificial intelligence and chatbots to really support the patient's journey. So these gaps are being filled as we are, like talking now. Thank you.
Am I audible?
Yeah, I think I think there are
Yeah, Mr.
questions,
Udit.
no? There are questions in the chat
Yeah.
box.
Mr. Udit, you are on mute, I think.
It's mute. You're on mute.
Hello? Am I audible now?
Mute. Yeah.
Yeah. Now audible. Yeah, again it is gone on mute.
Now?
Yes.
Yeah.
Am I audible?
Yes.
Yes.
Okay.
Yes, Mr. Udit.
So there is a very interesting question. Why do a patient loss of on the medication? Is it because of cost, or is it because of the process involved in getting treated, or is it because the patient has to take for the long time and they are not, so willingly taking the medicines because they don't want to take it? What is the exact point in terms of to understand this point, the problem of a patient?
Okay, go ahead. You're on. We are not able to hear you, Mr. Udit.
Hello, am I audible now?
Yes, audible.
The voice is
No.
breaking in between. That's why it is not been very clear. Mr. Udit,
Okay,
I
Yeah.
think
maybe
the
So
some
question is in the chat
choppy
box.
connection. So
I think it is for the.
yes.
So, I would just want to take this question which you just mentioned. Why do patients lose of medication adherence journey, which Mr. Naresh
Yes.
just answered. So I would want to
Yeah.
just add few more things. Is this the way the medicine is costly? No way. It's not about medicine being costly. It's about I have taken the antibiotics. I had upper respiratory infection. ठीक हो गया है 2 दिन में. They stop the medications. So it's all about feeling better and stopping the medications. Ideally, there are a lot of patient support programs, which are now done by pharma companies and health tech companies, where we, have health coaches, we have dietitians, we have physiotherapists, we have psychological counselors, telling the patient that please आपकी दवाई time पे लीजिए, please आपकी दवाई का पूरा course बराबर करना, and that is how we try and ensure the adherence or the prescription compliance, which is so very important because if you take antibiotics for let's say 2 days and stop it, eventually you will develop antibiotic resistance in future. So to answer this question, it's not about the medicine being costly, it's about the patient feeling better and stopping the medicine abruptly.
Absolutely right.
Yeah.
It is the patient's attitude. I always tell the cost is secondary, always secondary. Because even if you take an example, when you go in the market to buy something, and when you go in the market when there is a festival and you go, your attitude is totally different. So it is not only
Mhm.
the cost, because cost now in India there are many different ways the cost cutting, low cost medicines can be available. You can talk to the doctor, how can I be compliant with this all. So it is not only the cost, means like we should not be only bothering about the cost. So I think this is what you are taking your body lightly. So you are not understanding what precious jewel or precious diamond you have in your body. Human life is a very, very precious and durlab. So you must know how to maintain this, and that is how then you will adhere to the medicines. So this is, I think, the attitude only. I think there is a question for me, Mr. Udit. Do you think patient education
Yes, yes, ma'am.
posters really work in the clinic? So yes, definitely it works in the clinic. Uh, as far as possible, doctors should try and explain if any new therapy is coming up, or you feel that the patient should understand. Like for example, in my own hospital, we have all that awareness about women's wellness, inner health it is called in, but then it is in a very subtle way. Especially I'm a gynecologist, so we can off on and off, we cannot go very boldly for the diseases which patients should be aware. But then in a subtle ways we definitely put it up. Now in Nova IVF we have a very subtle poster that we focus on the self gametes. It is that self gametes means we approach to the patient and we encourage the patient to use their self gametes. So if you have less also, we can have the best outcome out of it. So this is the way I think all doctors and all wherever they are clinic, they should be certainly displaying what the new things are there, and that's how it will be the awareness.
Yeah,
There's another
I think
question. Do you think the patient counselors at clinic can help counsel the patient? Absolutely. As of now, the burden of the patient lies with the doctors. Which problems can get created? This is, I think, from Surat. This is very, very important aspect. As I told you, in India, patient comes directly on the doctor. So there has to be filter in between, and those filters are the counselors or your coordinators. And the way you've been filtering those patients and coming to you, that's fine. Or whenever you have diagnosed, many a times when the patient sits in front of the doctor, gets blocked, their mind is been blocked that time, so they
yeah,
may not ask the questions what they want. But if you go in a lighter atmosphere, they immediately ask that question. So you can have these filters, definitely makes a lot of difference. Or one more suggestion what I usually have: prioritize the patients. Like you should understand when the patient is coming for the first time, when the patient needs more counseling, when the patient is just coming for the report. So every patient will have a different timeline or time points. So accordingly, if you start adjusting your time, the time will definitely expands and you start giving time to everybody. So when any patient who has been very, very demanding and she needs more counseling, those patients you should time them totally different, and they also understand. But don't leave them because it is my heavy OPD. So it makes a lot of difference. So prioritize according to the need of the patient, and this you can
yeah,
plan, and you can tell your secretaries, and you can plan your organization. In the organization, things works with that.
yeah.
So this is what is the second question was been asked. Yes, I think Mr. Naresh would like to add in.
Yeah, I think Mr. Naresh
Yeah,
wants.
I thought I'll just add two posters. Yeah, see about the
Thank you, ma'am.
posters, very
Naresh, sir, would
strategically
like to say
designed. A
something.
good poster, can you hear me?
Yeah, yeah.
Yeah. So I was saying, these posters, if they are very well designed, it can really help trigger a very good question, from the patient to the doctor, because at the point of care, sometimes the patient, realizes that, oh, this back pain I have, and could it be osteoporosis? I need to just ask the doctor whether I need to do this test. So if the posters are very nicely designed, very strategically designed, then they can have good outcomes. The second question, about patient counselors, now with the advent of digitalness chamber, there could be a common, call center, from where you are reaching hundreds and hundreds of patients cost effectively, or you can do it through a chatbot, which is AI driven. So the question on AI is, very much happening. It's happening in AI chatbots. It is happening in AI through the e-Sanjeevani plan of the government, where they are trying to reach the entire country's rural markets through e-telemedicine, in the tertiary, from the tertiary doctors to the actual district clinics. So AI is going to help those less qualified doctors, help them diagnose, help them treat better. So I think the future is all technology. The future is all technology, which can help us, in terms of more cost-effective ways of treating patients and diagnosing patients. In the backdrop of such a big shortage of doctors in the country, because our country needs 600,000 more doctors to treat all the patients, which is not going to be possible. So that's why, multiple ways of achieving this will be useful.
So,
Yes.
just one point on this counselor question, as Dr. Bharti and Mr. Naresh has already answered most of it. I would want to just add that counselors are important pre-consultation for sure. They act as a filter, as Dr. Bharti and Mr. Naresh rightly mentioned. But even post-consultation, as you're talking about the call centers or health tech companies having counselors, and then they can reach out to the patients. That is also very important from the prescription adherence perspective, or if they have any further queries. Doctors may not have the time, and as Dr. Bharti rightly said, you have to prioritize and time the patient accordingly. So pre-consultation counseling and post-consultation counseling both are equally important, and I think with the help of digital support as well as in-person support, these things can be achieved.
Yeah.
Oh. So that's
So
how
there's one question.
yes. There's one question. I think this patient education journey needs to be
Yes.
designed. And can you help with the process steps? I think it is from Kolkata. So I think Mr. Naresh would like to take
Yeah, yeah. I think
patient
it's a
education
very
journey.
very nice question, very good question. I think the journey starts with the awareness. So that people who are likely to have the disease, target patients who are likely to have the
Sorry,
disease, get
panelists.
awareness, then get them, give them some direction. If they have these symptoms, then they approach a doctor for consultation, facilitate the diagnosis. And then I think the next step of the patient education journey is telling a lot about the disease, what are the things to do and do nots, so that they can manage their disease better in addition to taking the treatment. A lot of information, on adherence, how to use the medicine, that augmentin has to be taken better after food, so that there is no diarrhea, or after inhalers, take a gargle. So these things, a lot of education would be there when the prescription comes in. And after that, I think the last step would be to, reinforce the importance of adherence and continuous monitoring, so that the patient, is really experiencing the best of health, and he can do more productivity like any other person who is not having the disease. Yeah.
Yeah, this is the way I think education journey should be.
Thank
Education
you.
has to be from awareness, access, and then diagnosis, and then the care, and then the adherence. So these all
Yeah.
aspects, I think Mr. Nadesh said very well. So this was good.
Thank you.
Mm. Thank you so much. Last 5 minutes, I
Yes.
was struggling with my internet, so weren't able to
I know I
understand. So finally, I
could
got
get that.
connected.
Yeah.
So
There's one
Thank you
technology.
so much.
aspect I wanted to just highlight, because if it is a last, I think 1 minute.
Yes, ma'am.
See, there are three aspects we see the life is helping,
Mm.
fixing, and service. These are three aspects which we see. If we can implement, especially in the patient-centric system. So what happens when you are helping? You think that you have been treating a weak. Whenever you help, you think that the person opposite is a weak, and that's how I have helped you. That is one aspect. When you want
Mm.
to fix it, any problem you want to fix it, you always think that it's a broken, and that is the way I have been fixed it. So this is actually this is not the way it should be. The way to it should be a service oriented. When you have a service oriented aspect to anything, the moment you do that, you see the life is as a whole. So if you look at the patient as a life, is a living entity. This is a jivatma which is actually have a reciting soul inside the body, and along with that soul there is a super soul. The whole perspective changes. Your treatment options, you're looking at each and everything changes. You don't think that this is a structure which is a robotic structure. It's not. So once you have that serving aspect, I think everything changes. You must have seen many places whenever good people also, when they start serving, they have been actually the authorities. But when they come to that serving aspect, they feel very good inside because you've been serving as a whole. So this is the patient-centric approach should be like this. And the whole healthcare industries, all organizations, if they start, but only very differently, this is also been taken now. Patient-centric doesn't mean कि as soon as patient आता है तो उसको पानी दे दो, खाना दे दो, उसको लाड़ प्यार करो, बहुत से लाड़ प्यार करो, उसको इंटरनेट दे दो, उसको ये दे दो. See, these are not the services. The patient has not come over here in the hotel or in the mall or anything where you need these all things. But here patient needs the awareness, what the diagnosis is, what is my treatment line, and how can I be best, and how can I fix my problem. So this is the way we have to tell. Even patients should also not think that, oh, ये hospital में तो Wi-Fi ही नहीं है. This is not. This is, you are not come over here for Wi-Fi. You can treat. You can do the things at home, your own things. But here you have come for your health. It's your health. If you prioritize, the other person will know the priority. If you not prioritize your own health, the other person will not also have a priority. So this is the way I think the gap should be lessened.
Excellently mentioned the key aspects of it. I think from the aspect of HCP and the patient angle, how we should understand that, and how a pharma industry should take this relationship in a way that how we incentivize in terms of making sure right information flow from the both angle is going, so that there is a proper connect and there is a right way of communication can be developed more profound way rather than just on the explicit or top of the icebergs part of it. Very excellent. I think I have not been a part of that question asked session. I'm very much sure that that has been taken very well, and I'm really thankful for such a fantastic learnings aspect. And I hope every single viewer have taken a great learning from it, great observations from the different industry metrics. Yes, Dr. Mathi, please.
There's one more point. The pharma industry, like especially Mr. Naresh and Sandeep, Dr. Sandeep, I would like to know, or the whole government actually, or the pharma industry. Pharma industry was being focused on the doctor perspective more, because see,
Right.
doctors are they're actually a customer, point of care. Like the doctor would prescribe. This is the way it used to be. Slowly things have been now coming to an end to that, because it is an exploitation or kind of a that things have been happening. So the doctor is been in the less focus. So now let them focus to the patient more, the pharmaceutical people. And I think government or maybe a drug control of India, they should allow the pharmaceutical companies to have a kind of awareness through the posters in the clinic, or in the, I always keep on telling them, why not you should have a public program karo. Like pharmaceutical people, I should used to say that you try and get the help for the public program. So public program will definitely emphasize the awareness and all those things. But probably it is not still focused. The government doesn't allow, or their budgeting or these all things doesn't allow. But if we can have that aspect, like Cipla has done for that, so many advertisement for that asthalin, that inhaler and these all things. It's beautiful things. I mean, the people come to know, oh, fine, I can take that. So, but authentic, very proper. We should know that authentically
Mm.
message should go across. Not like we are not making a movie. We are not here to entertain the people, and we are not here to make money out of that entertainment. These three aspects, if we understand when we are making this journey of education, this is going to help in a long run. So pharma is a very big source of awareness. They should actually be involved in the awareness, and few of the companies are really doing very well, but not everybody. They should have that some CSR activity focused. They should be doing this. Unless and until they can't go ahead, this is the compulsion. If it is made by the government or DGI or whatever, things will work, I think. This, and doctor has to understand the compassion. So everybody should understand their role. If they have that understanding of the role, and we all should know that center focus is our patient. So center focus is a
True.
patient, and we are all for the patient. So, and everybody, administrative people, all nowadays, doctor is not the only person, but administrative team all together should work for the patient. And the patient should understand, if I'm an emperor now, that doesn't mean they are not of use or they are less value. No, if they are serving you, that's why only you are emperor. So this is the both way, I think. If this goes ahead, um, I think it will be win-win situation.
Uh, Thank you so much, Dr. Bharati. I think great amount of perspective, and in a different angle, you have mentioned about the relationship between all three major stakeholders to make sure the patient has to be a center focus. Dr. Mr. Naresh has widely told the basic importance of patient adherence, which is the ultimate fulcrum to make sure patient have been healthy for a long time, which is the ultimate objective. Dr. Sandeep has clearly mentioned the different aspects, how a digitization prospect, how we make sure there should be a balance in terms of it, to make sure that patient knows what is the ultimate value of importance of HCP counseling, or the prescription value, or the awareness value of it. Great perspective have been identified today. Thank you so much for your time. I think it's a great learning for everyone, even for me as a marketer, and it will help me to implement some good amount of, best of it in my day-to-day profession job. Thank you so much, everyone, for your wonderful time today. And I think we can close the session. Thank you so much, everyone.
Thank you.
Thank
Thank you
you.
so much.
Thank you, everyone. Thank you.
Thank you, Dr.
Thanks.
Narendra,
Thank
Dr.
you.